Hi everyone, I'm Jennifer Rayner.
And I'm Sara Bhatti.
We're researchers from Ontario, Canada, and we're here to talk about our paper titled Using Self-Determination Theory to Understand the Social Prescribing Process, a Qualitative Study.
When we were implementing social prescribing back in 2018/2019, there were a number of papers published on the positive impacts of social prescribing, but very little explaining how social prescribing actually produced these positive outcomes. In our study, we interviewed over 90 patients who had received social prescriptions from 11 Ontario community health centers and used self-determination theory as a theoretical framework to help understand the mechanism behind social prescribing.
Using this framework, we found that social prescribing worked for many of our patients for three important reasons. One, it gave them a voice in their care, such as they had decision-making power in regards to their care plan. Two, it helped to address health needs that were important to them. And three, the process fostered trusting and supportive relationships between patients and their providers. By applying this established psychological framework to understand how social prescribing works, we can develop evidence-informed guidelines and goals for other organizations who want to develop their own social prescribing programs.
For me personally, what really stood out in the patients' interviews was how much it meant to people that the providers didn't say, "I think you should do this," but instead asked, "Would you be interested in this?" Making this simple switch gives the clients a voice in their care, empowers them to address what's important to them, and helps build a trusting relationship with their provider.
And that's really what person-centered care is all about.